Pleasure to be here and to moderate the discussion this morning. It has the title, Catalyst for Collaboration, Improved Access and Commercialization to Health Innovation. And I can't think of two better people to introduce and overview this topic than the two speakers we have today. And I'm going to introduce both of them, and then they're each going to speak for 10 or 15 minutes, and then we're going to have a little discussion among the panel, and then we're going to open it up to you. And let me set one ground rule, having been at a number of these. I know when you ask your question, you want to have a supplementary question, but unlike Parliament, we're not going to allow you a couple of supplementary questions because sadly there are always still hands up by the end of our allotted time, and we want to have as many people as possible. So you got to pack it all into that one question, which isn't to invite a speech, because sometimes it's unclear what the question is. So let me start on the introductions with Neil Fraser. Neil's day job is as President of Medtronic Canada and Regional Vice President Canada for Medtronic, but Neil devotes an enormous amount of his time to trying to advance the cause of innovation in health in Canada. Most recently, as a member of the what gets called the Naylor panel, but I think officially the Advisory Panel on Health Innovation that was set in motion at the tail end of the Harper government. They didn't know they were at the tail end of the Harper government. They were, I think, planning to implement the recommendations of the report. It speaks very well of the panel, David and Neil and their colleagues, that the current Minister of Health has said very positive things about the report. When you're appointed by one government and the next government likes the report, it's usually because you've done a first-class job and a nonpartisan job. And so Neil is a frequent speaker and has been on, I think it's fair to say, every panel involving innovation in health in Ontario over the last number of years. And I think he will provide a very good context for our second speaker. William Charnetski is, and I want to make sure I get the title right, Chief Health Innovation Strategist for Ontario. That's a way better title than most of us ever have. And he has spent over a decade in transformational change and comes with a strong track record. And I'm fascinated because I met him early in his journey, which I described him this morning, a little bit like Marco Polo, exploring technology and health innovation in Ontario. And the Ontario government alone would rival the China that Marco Polo visited, I believe, in its complexity. So I'm really, really curious to hear what Bill has found on that journey over the last number of months and where it's taken him. So without further ado, Neil, would you like to start us?
Michael, Bill, Longwood's guests, welcome to our discussion this morning. I'm going to talk a bit about how health innovations can positively impact both patient outcomes and the economy. I'm going to start us off by giving some background on Ontario and the famous OHIC panel, Ontario Health Innovation Council, which recommended the development of the role that we just heard about, the OCHIS, the Ontario Chief Health Innovation Strategist, which is Bill Charnetski. Then Bill will provide an update on the work that he's doing as a catalyst for improving access and commercialization of health innovations. And as you see here, I've got an airplane because making changes in healthcare is a bit like the proverbial, building an airplane while it's in flight. It's very challenging because of the barriers and the challenges of change in healthcare. And it brings to mind both incremental improvements that can be made sometimes, and in an airplane that would be adding a TV screen or maybe making the seat a little bit wider or more comfortable, especially for me. And then there's the radical changes, and the radical changes might actually be not even flying, but using WebEx or Skype and finding a more modern, contemporary way of connecting without actually having to be there. In healthcare, this means focusing on health outcomes, economic value, and breaking down the barriers, down the budget silos within hospitals and across the healthcare system, and perhaps shifting away from fee-for-service and looking at new ways of delivering care. And just to define our terms, and I often reference Roger Martin, who's often said that innovation is not invention. In Canada, in healthcare, we spend over $1 billion on research in healthcare through CIHR, and yet very little is spent on health service research, which really addresses the innovation area. So the key barriers to innovation in health, as we see it, are access, procurement, and adoption. And just to talk about access, and it's easy to be confused with the term because there's different kinds of access. You can think about the access of patient to the healthcare system, and from the Commonwealth Fund survey, we've seen that Canada is really performing poorly in access, particularly to primary care, where only 22% of patients are able to see their primary care provider within 48 hours. But I'd also like to broaden the discussion on access to talk about access for small, medium enterprise to the healthcare system. And here we have a tremendous balance of trade gap between what we export and what we import, and the access, the actual sales of Canadian-made companies into our healthcare system. And that gap has been growing steadily at a 35% rate over 5 years. And I could give an example of a company I encountered in Calgary called Calgary Scientific, which makes cloud-based radiology platforms, and they're unable to sell their product in Canada. They do very well at Kaiser Health and Intermountain and other groups like this, but they face incredible barriers, so they just don't have business in Canada. And then there's the perspective of the process of introducing innovations into the healthcare system. And we now talk about two valleys of death. There's perhaps the financial valley of death of getting a company or an innovation started. But now there's another gap, which is really, once you've developed the appropriate evidence, how do you access the healthcare system? And here there's many challenges. We have, our Health Canada, which is a very good regulator, but essentially doesn't leverage what goes on in the U.S. or Europe, and ends up that they're one of the slower approvers of new technologies in the world. In fact, they're second last. Only Japan takes longer. And then there's the fragmented health technology assessment environment where we have 12 to 15 different agencies. And yet, when they come out with a recommendation, it's not binary, because if they say no, we all understand no. It means the evidence doesn't justify applying the innovation. And yet, when they say yes, it's equally confounding that something may or may not ever happen. And so that's really the challenge of developing a process that says, if you have the appropriate evidence, both from a value and an outcomes perspective, then why is this innovation not applied broadly across the healthcare system? So that's a significant challenge that we face that's fairly unique in Canada. And adoption, of course, can't happen without procurement, which leads into another one of our challenges. I think procurement works very well within the bounds of what's currently available and currently funded in the various funding envelopes. But how do we procure faster procedures with fewer complications? How do we procure remote technologies that get patients out of hospitals and managed in their homes? How do we procure risk-sharing services, solutions that can improve the productivity in healthcare? So these are all challenges that we face. So coming back to the Ontario perspective, it really, the Ontario Health Innovation council was only really one step in a process that really traces back to 2010 when Sandra Pupatello was the Minister of Economic Development, and started to understand what were the barriers for industry, homegrown industry in healthcare to grow in Ontario. So she had this open for business process that had the goals of reducing red tape and opening the Ontario market to global and homegrown industry. This then led to something called the MedTech Working Group, which essentially got three ministries together, which were health, research and innovation, and at that time it was finance that was responsible for procurement policy. That's now MGCS, but essentially it was a tri-ministry group. And then this led to the development of the OHIC panel, which included people from across the health system, including health CEOs and others, and that ultimately led to the creation of the OCHIS position. Just to back up, the Ontario MedTech Working Group worked on issues like the adoption of technology and the growth of small-medium enterprise in Ontario, and identified there was a need for better communication between industry and the government about the challenges they were having of commercializing in Ontario. There's the issue also of alignment, which is, it's great you want to commercialize, but are you really solving an important problem in the healthcare system? So that's really the opportunity of government to table, these are the big issues that we want to address. And then, of course, there's the procurement, which is how do we strategically procure and get the innovations that we want into the healthcare system. Then the OHIC panel, and these are all the folks that were involved in that, further focused on these issues of access, procurement, and adoption. And their focus was on improving healthcare, and well-being in Ontario, wanted to spur innovations that lowered healthcare costs, increased quality of patient care, stimulate the environment for job creation in Ontario, and ultimately to attract the best and brightest researchers and entrepreneurs to Ontario. And so ultimately, what happened was with these three envelopes, the Ontario government has invested in procurement innovation to improve the process and access of innovative technologies in Ontario. They developed an adoption with evidence strategy, which is really to address extending from the health technology assessment into adoption by the healthcare system. And then finally, we appointed an OCHIS who would marshal all of these forces to lead to successful application of innovations in the Ontario healthcare environment. In the meantime, back at the federal government, as Michael indicated, and often when we talk about Ontario, we couldn't address all of the issues that were present in healthcare that represented barriers. And so at the federal panel, we identified 5 areas for focus. One was about patient empowerment. We identified that patients don't have access to their own health records and information that could be very important for engaging them in managing their own care. Secondly, we identified that medical professionals often lack the scope of practice to use the resources of the healthcare system most efficiently and to deliver integrated care. Third, we identified that Canada and Ontario as well were falling behind in areas like digital health and personalized or precision medicine, and there was a need really to rapidly catch up in these areas. And then fourth, again, it brings us back to procurement, reimbursement, and regulation, which all represent opportunities but also barriers to the adoption of innovation. Then finally, we talked about the idea that industry could be an economic driver, and you could point to the example of Denmark,